because I was seeing elderly patients who are really struggling with the bite and completely coming every 2 years, 3 years. I used to do this big composite, it cracks again, it breaks, not because what we did, but because of their bite.
Hey guys, welcome to the CPD Junkie podcast, where we bring you interviews with dentists sharing their CPD stories and journeys from around Australia. I'm your host, Lawrence Doan, and today we're joined by Dr. Vivek Alagati. He always wanted to be a doctor, but had a desire to be creative. Dentistry was a judicious blend of both scientific knowledge and artistic skills, which challenged him. So Dr. Viv earned a BDS in India in 2005 and then cleared his exams to become a member of the ADC in 2010. To date, he's taken ones in full mouth rehab, wisdom teeth extraction, and dental implants. For him, there's nothing more fulfilling than helping his patients achieve a healthy and beautiful smile. He has considerable expertise in a broad range of dental services, including cosmetic restorative treatments, implants, and surgical extractions. He treats patients under sedation and manages dental treatment in hospitals under general anesthetic. Dr. Vivek Alagati, welcome to the show.
Thank you, Lawrence. Thank you for a wonderful introduction.
So tell us about your CPD or dental journey into developing expertise in full mouth rehab, wisdom teeth extractions, and implants.
Yeah, I came to Australia as a new graduate. Actually, I didn't have much experience back in India, and I came as a new graduate. I was after clearing my ADC, I joined in one of the surgeries in Perth. I had no clue what I was doing that time, and I didn't have any mentorship. But the workplace, I didn't like that area where there was no mentorship was available. And I left, and I found this place in Country Town through dental job sets. That time, Simon Palmer helped a lot. And as soon as I joined here, it was a country town, and we were doing a lot of patch-up dentistry, a lot of dentures. Though I had mentorship, but not experiencing what I wanted to do in dentistry.
Right, yeah.
And first 2-3 years, I didn't do much CPD. I was doing just one-day courses, mainly in endo and, restorative dentistry, children dentistry, because I was seeing a lot of kids and a lot of elderly patients here in dentures. But one of my good friend, Shabana, she put me on Style Italiano. That time the world dentistry was going on Facebook and everything, and she added me onto DPR as well that time, and that's how I actually exposed to a lot of this wonderful dentistry being done from great dentists all over the world. So that's when from 2013 2014 actual CPD journey started.
Right, yeah. So earlier on, you're saying because you were so busy working, you could only attend, the weekend kind of courses, or was it because it really wasn't on your radar at that time because you're really just focusing on doing the work, and that's what happened?
That's right. And my principal dentist that time was, he used to do CPD, but mainly focusing on where we can do only on the weekends and local CPD in Perth. That time there was not many CPDs available in Western Australia. Everything we had to travel, and being in a country town, going to a CPD in Eastern State was a big trouble. We had to maybe block from Thursday and even Monday. We use a lot of working days has to be blocked. So we were doing only local CPDs. But I didn't get much value out of those, and I was basically doing just to keep the certificate.
Yes, I understand.
So many CPDs, but
yes.
Actual the thrust for knowledge only going after I've joined DPR, and I've seen this wonderful post from all over the Australia, how amazing dentistry they were been doing. So that's when I started okay, I need to up my game, and I need to get onto this, and I need to learn all these cool techniques.
Sure. And so what kind of caught your eye earlier on?
First, actually, I wanted to do rubber dam course because I was struggling with my restorative work. being in a country town, I see, some of the cases like severe caries, deep caries, and I was struggling to put on the band properly. I couldn't isolate properly, and I was like hating my own work, and I was in a situation where, like, whether I'm in a right field or not.
Right. Yeah.
And then um, everybody recommended Sahil's rubber dam course because, like, and then I think that is one of the course which I did changed my dentistry completely. And Sahil was like posting a lot of this inspirational things on DPR as well. One of the message which caught me on how he started when he was a graduate and how he gained to a situation where he was. He wrote a beautiful article, actually, beautiful piece of message that inspired me a lot. And
Fair
then
enough.
I did his course, Rabadam. He was so approachable, and after that course, I've been in touch with him. I was posting my cases to him on Facebook, and his personal Facebook message and WhatsApp. And he used to give me inputs, and used to suggest me, okay, if you want to do this, do that course, do this course. And that's how it started. And one of my good friend, Raghunath, he dragged me to Pascal Manet's course. And
Wow.
that time, actually, I didn't have much money, but that was around like 12 grand course.
Yeah, it's expensive. Hey, yeah.
It's a big
It's
deal.
rare for him to come down, so that's probably why as well.
Yeah, and that changed completely everything. Actually, whatever concepts I had till then, completely wiped out. It's like a new slate after that course.
What course was this one? Was this the semi-indirect and semi-indirect one?
Yeah, it was a full workshop on semi-indirect, direct, bonded dentistry, and even a little bit on digital dentistry. Dr. Pascal Manet's course back in 2015, I think. Yeah, after that, I was like, I wanted to get into this, and I was doing a lot of indirects, taking the impression, doing the way he was telling, like big composites on the models first, then bonding them indirectly. And my principal dentist was also onto it. Like he supported me a lot that time, even though I was wasting a lot of clinical time trying to do something different, but he supported me a lot, and he gave me a lot of encouragement. So, and being it's a small country town, everybody came to know that, like, I was trying to do something different here. And not many dentists, like all our patients, this surgery has been there from 50 plus years. So we had a lot of this elderly patient who was coming to this surgery from long time back. All of a sudden, I was doing everything under rubber dam, and they were like, no other dentist did this.
Yes. Yeah.
And then they could see I was trying to do something different, and they were really appreciative too. I was taking a little bit more time to start with, and I was photographing each and every step what I was doing. And they was like, why are you taking all these photos? All the patients. And then I want to improve my own work. I can see my mistakes, what I am doing from these photos, and I will ask, a good dentist way where I'm going wrong, so I can improve. They were really supportive as well, the patient base here. And that's how I like build on, like, okay, this mistake I did in this case, I would post immediately to Sahil what I did wrong. Now he will give inputs, and then that's how it started.
Wow. So you're saying basically after you did that course, that was your journey into, so you did the Sahil's course, he recommended something like Pascal Manier's one, and that was what catapulted you into doing, was it more cosmetic restorative or was it more rehabilitative, full mouth rehabilitation?
That time more of the cosmetic and restorative. And then I was seeing like a lot of wear patients where the bite is completely gone, and I didn't know what to do. And I would ask again, like, my mentors, my friends, what best to do here. That time with my communication and everything also, I wouldn't tell patients like a big treatment plan or anything. I would like, the only thing I know that time was to build up with composites.
Yeah.
So I used to, like, take the impressions and post these models to all the mentors, and then they said, like, why don't you look into a full mouth rehab course? And first full mouth rehab course I did was like, again, my friend Raghu, he dragged me to the course with Lincoln Harris.
Yeah.
At that time, he was giving a practical hands-on course with our own patients. So I found a patient, I flew him from here with me, and we gave him accommodation, we paid for everything, and I did
Wow.
that. Yeah, that's again one of the other game changer for me. Like, so I could get into more restorative work with not only just with composite, but with the indirect restorations. And that another path which took me again, okay, I need to go into more of these kind of cases now, because I was seeing elderly patients who are really struggling with the bite and completely coming every 2 years, 3 years. I used to do this big composite, it cracks again, it breaks, not because what we did, but because of their bite. We are not considering the deep bite or the wear are not completely into consideration, because I didn't know. Even though I know, I couldn't give the options, like, because I was scared, like, if I tell, like, this is going to cost you 30,000 to fix everything. But yeah, Lincoln Harris course not only changed the way I was looking at the bite, but he gave a lot of inputs on communications as well, how to take the patients, like, understand their problems and properly communicate with them their problems. And after that, because I only treated one patient with that course, there was a lot of gaps in the knowledge as well. Like, what if something different comes?
100%.
If the patient with only anterior attrition comes? What if the patient only posterior attrition comes? Then again, Sahil advised me to do a mini residency in prosthodontics with Dr. Tony Rotendo. And that's when I did that course, hands-on and theory. And in the meanwhile, one of my friend advised us spear education as well. So I did that online spear education course in full mouth rehab. There were like a lot of lectures on there, like from awesome dentists all over the world. So I could get into those lectures online, and that was really good. I could, like, read all the notes and everything, or watch videos whenever I want online from my own place. So
yes.
Yeah, that took me into the other direction. Then I did a lot of full mouth rehab courses after that, like even from India. And we flew, actually, all of my friends together here. We flew one of the prosthodontists from India, and we organized our own hands-on course here in Perth. That was great too. So
yeah. So I'm just going to rehash on that. So basically what happened was you were doing single ones first, and then you started realizing, okay, now you've got some full mouth rehab cases, and you wanted to do a practical component first that had a live patient component to it. But then what you found was that, hey, there's going to be variance in the type of full mouth, and you feel like there was gaps in your knowledge. So you went to go find courses that were theoretical in that aspect to try to supplement what was kind of happening. And then on top of that one, you felt, okay, now I've got the theory as well, but actually I feel like I need to go a bit further, more with more hands-on kind of CPD. So that's kind of what compelled you to go overseas and do some of that.
That is right. What I found with the CPD courses is, like, once you do one CPD course, it'll give you a thirst for knowledge. Then you come and implement, then you find more problems. Okay, they didn't talk about this part.
Yeah.
Or else, like, you're doing practical, the theory, but that theory never applies practically. It may apply to one patient, and the next patient it changes.
Yes.
Then you want to learn more, like, then you'll find another course. Luckily, I found exactly, like, when I did the practical course first,
yes,
I understood, like, my knowledge is not enough to, like, approach each and every case. Then I went did the theory course. Then I understood a lot of, like, actually what I was doing wrong, or where my diagnosis is going. Like, you need to diagnose differently, or you need to give the treatment plan differently on some cases. You can't just do everything with ceramic. You can do, like, a bit composite work, bit ceramic work, and bit of implants. You need to put everything together.
Right.
That's how I understood. Okay, now my knowledge is starting this aspect of the dentistry. Then I would go and do implants. Now I need to learn implants too. You can't just do, with, like, limited materials.
Yes.
Then I went into implants. That time, the problem was my principal dentist was in later stages of his dental career. He didn't want to invest into a lot of gadgets and stuff. He wanted to retire slowly. And when I wanted to do implants, and my colleague, he was not ready to spend around like 30-40 grand into implant motors, buying the implants and stuff. So he said, if you want to learn, I'm happy. I will hand over the surgery to you and you do whatever you want.
Right. Yeah. So talk to me about that. Yeah, talk to me about that. Because, a lot of associates are in that particular situation, but they're like, the practice doesn't do it. They don't want to invest in it, but the associate is interested in it. How do you kind of take the leap?
Yeah, I was never really interested in practice ownership. Like my personality or my understanding about the accounts and this one is very poor, really poor. So I was always like, asking my principal dentist only like, first when I went into, the rubber dam also, I used to buy my own rubber dam because nobody else was doing in the surgery. I wanted iso dam, everybody using the normal, green rubber sheet, and it was tearing everywhere. My practice manager at that time, I don't want to buy you this expensive stuff when nobody else is using, because we are a big surgery, 4 other dentists was there, and only you wanted to use this. I invested in those small things myself, but like when implants comes to, it's a big investment, and I didn't want to just invest from my own and then do it here. That's when I spoke to my principal dentist, and he said like, I'm happy now in this later stages of my career. If you want to take over the surgery, you're happy to take over and you do whatever you want. And then my wife is also a dentist, and I spoke to her, and I told her like, if you are happy looking after the expenses part, like surgical ownership part, I'm happy to take over the surgery. And she said like, okay, I will go into that field. And she has been a really good support. She reduced her clinical days, and then she's been a practice manager, and she's looking after the financial parts of the surgery, and I could concentrate just on the dentistry. And that's how we went into implants, me and my colleague. When I joined back in 2020, my colleague was also there. Like we grew together. So I dragged her. We both went and did implant courses, and then we invested in implants. We started doing slowly, getting into implants and everything. She's very smart. She picks up everything very quickly. She's like absolute like gifted talent. I have to do 2 times, and she can just observe and she picks up. So I do all full mouth rehab courses, and I come back, I explain her. She don't even have to go to a course. Like she observes and she picks up. Like she does better than me.
She's like a super sponge. She just put it in there. She just soaks it all up.
Yeah. So actually, she gives me a lot of support. Like a lot of that comfort zone. So we both grew together. So we invested in that, and then even I did 2 courses before her. She did the first implant, and she did she's doing now. I have started to do. That's how we complemented each other, and we invested in implants. And first one was implants. Then we looked into digital dentistry. We wanted to bring digital dentistry into a country town. But finances wise, we were a bit worried because we just took over the surgery. It was a paper surgery. We just converted everything into computer based. We invested a little bit on that, and then we invested on implants, and we wanted to get into digital dentistry. So we were looking for the options for like a second hand kind of mill and a scanner. That time, one of my good friends suggested John Scullo from Nexus. He gave us a good deal with a Serec, and we bought a Trio scanner, and that's how we got into digital dentistry. Actually, my principal was like a little bit scared. He never used a computer. He never used anything digital.
What's a phone? What's this mobile phone?
That's right. He still have that like old Nokia mobile phone. He was like Yeah, but like
Yeah.
he's been great support. He was like on board with everything, and he loves digital dentistry more than me now. He scans everything. He does a lot of dentures. He's not gone back to the impressions now. He scans everything, even his like RPDs, even full dentures. Sometimes he scans.
Wow.
Yeah.
There you go. I think, there's a few gems there for some of our community as well. How you said that earlier on, just because you couldn't get the material that you wanted, that didn't stop you from going out and buying it yourself because you wanted to take your dentistry to the next level. And then, and then what you were talking about was, because I ask a lot of guests as well, if they reach a point, all of us at some point where we start to contemplate about practice ownership, about being a specialist, about being a super dental GP or, starting a family. And you've mentioned that what really kind of allowed you to make that decision was your partner being supportive with you 100% to make that plunge. Because otherwise, like you were implying, is that you probably wouldn't have made that jump.
No, yeah. So if she said like I didn't want to look after the financial part, I would never have gone into the practice ownership, because from start, like as a kid, I know my strengths, I know my weaknesses. So my dad, being a doctor, actually is always used to say, "You are never a good organizer. You are never a good, never good with money." Whenever like money comes to me, I don't know where it goes. Like I just spend it. I don't even know where I'm spending. I'm very bad. I'm very bad with money management. That I know from the start.
Yeah.
So my wife, like, yeah, she said like, I would look into that, because actually my principal dentist also, as soon as I took over the surgery, I was like making all these changes. I was spending all the money onto the computers and like, new gadgets. And he warned me like, please don't go like that fast. Take a step, like, slowly. That's when I wanted to buy brand new CEREC and everything. And my wife talked sense into me as well. Like, we are making changes in a small country town. We don't know how many people will be into it. Even like, my principal dentist being, whether he will use that or not, because he used to see a lot more patients than me that time. I was still taking time. I was still taking photographs, and, I was doing my dentistry a bit slow that time, because I was more concentrating on, providing lot better dentistry than like lot faster dentistry. So I was seeing very limited amount of patients, because like I was taking time.
Yes.
1 hour I used to do, 2 fillings in 1 hour. That time I was not making much money.
Yeah.
But I was not concentrating on money, because like my wife is also dentist. She was earning a good amount. So I was concentrating more on like getting my dentistry better.
Yes.
And she talked sense into me, and then that's how we bought the second-hand a milling unit and a scanner.
Yeah.
Actually, we didn't go into CEREC as well. We bought Trios and a Sirona mill, and we combined hybridly with the in-lab. So it worked out almost like 85-90 grand cheaper.
Well, look, I want to say, there was, during that time, there probably wasn't a lot of info or CPD on digital dentistry. So how did you kind of go learning all of that? Like you said, you were using 2 different systems. There would have been a lot of headaches.
It was. I was like next day only, let's buy CEREC. It's a lot easier. But like, no, again, my friends were in digital dentistry by then. I bought this 2017. I used to again ask a lot of questions to them. Like they were really good help. And I went and did Lawrence Law course on CEREC. That was a really good course. It helped a lot to understand actually basic concepts like how to scan and how to design. Was a good bunch of dentists there. Was really helpful. And again, Sahil, I used to post again to him, how do I get over it and everything. And John Scullo, who sold me the unit, he was really good help as well. I used to call him in the evening, and then I used to come online. He used to come into my computer. He used to help me with the designing part, where if I'm going somewhere wrong, And good thing with the digital dentistry is like it's not like an impression. You did a mistake, you can't, like, you have to do it again. It's like a toy. You keep on playing on it, you learn more about it. You did mistake, you can easily erase it at, okay, I did wrong here, I have to get better here. Immediately you can see all your mistakes in the digital dentistry. And where with the impressions, our technicians are so good, actually they mask all our mistakes and give us beautiful crowns. With the digital dentistry, you're your own technician. So I could see a lot of my preps were like having undercuts, and the margins were not clear, and that improved my dentistry too. Digital dentistry scanning, and you see your own prep. Okay, this is really bad prep, I had to re-prep this one. Then the patient is sitting there, you can easily correct and you can rescan it, and that's improved my dentistry a lot as well. And after digital dentistry, actually what I learned from Pascal Manet's course, I could implement so well. Before, with the impressions, I could only do a little bit. I used to left the other part to the technician to provide me what I was thinking in mind. Sometimes it never actually goes that way. But with the digital dentistry, I could only, like, I am my own technician now. So I can really prep and design the way I want.
Yes.
It changed a lot. And as I said, my principal dentist never used any computer before. He does beautiful designs of like this Emacs crowns and everything. He loves it.
Well, I think that's an interesting point you talked about, how that learning curve made you learn exponentially through that digital, because you could magnify, you could see a lot closer up, and then when it came to actually constructing it, you saw your own issues, and it all fell on you because you couldn't blame anyone else.
No, you can't. Yeah, you can't. And actually it helped with the patients as well. That wow factor in a country town, they have never seen anything like this. All of a sudden they're seeing their all problems. Photographs, yes, but like even digitally, it tells them immediately, okay, my that filling is also not looking good. What do you think? They started asking questions. And that helped us as well. And being in a small country town, this helps too. The word of mouth was like blown out. People go out and tag these guys are trying to do something different. These guys are trying to bring all this kind of technology into a country town. And we were even local journalists came and like put us on articles, like, we are trying to do something. When we bought CBCT here, people were traveling almost 300 kilometers to get a CBCT done, and spending a lot of money, not only on the technology, but they had to go, one day is wasted, they have to wait, they have to get an appointment. Now they can come here, they can have their CBCT, and we are planning in one day, within 2 days they can have their implant done. So that's changed as well in the local community as well. That we are trying to help them out, not only with the good treatment options, but also with their, like, they don't have to travel 200 kilometers now.
Yeah.
Especially with the elderly people. Some of my patients where I've done implants, they have to, like, ask their friends or family or somebody to take them to Perth to get the CBCT done, or these X-rays done, or anything.
Yeah.
So now that they don't have to now. They can just walk into the surgery and have the CBCT done. So.
I want to ask as well, how did you know, because a lot of graduates, when they graduate, they feel like, I need to go learn ortho, I need to go learn implants, kind of straight away. How did you know that implants was the way that you wanted to go? Was that because you were kind of knew you're interested into surgical aspect because you were doing wisdom teeth?
No, not really. No, actually, I was scared of implants till now. So I don't do too many implants. I do implants where exactly necessary. I will still give the option of bridge if I can. But like some cases you can't just do restoratively. They absolutely needed implants. And obviously they are the best option, especially one single tooth missing, or even if you are going on all on four. Actual implant, the journey which I wanted to take started, actually I wanted to give all my denture patients really good, like retentive dentures. That's where it started, because our population here is more like a retired elderly patients.
Yeah.
My denture, I used to really struggle with my dentures. Actually, I went and did a full denture, proper denture course from one of the German prosthetists in Brisbane. And the way he was doing dentures was like really with Gothic arch tracing, two impression, double impressions. He was setting up his own teeth and doing a try-in with anterior teeth first, then the posterior teeth. It was like a 4-day course I did in Brisbane. I thought like I'm not doing any of this in my regular practice. And some of our patients used to come from 200 kilometers, 300 kilometers. I can't ask them to come 10 times for just doing one single denture. If I am not doing that kind of denture, I better do implant dentures where the suction is there.
Yeah.
That's how I went into implant dentistry. That keeping in mind, but like I really help now with single implants and everything as well. The other part is like I find, as you're doing your dentistry, as you're like getting more and more comfortable with the normal procedure, at a point it challenges you. This is not challenging enough. I need to go into the other aspect now. That's how the implant journey started, because I was doing a lot of wisdom teeth under general anesthesia as well. And but wisdom teeth comes out at the end, they heal somehow. Implant has to stay in properly. You still need to understand a lot of biology and soft tissue around the implants and everything. So first I've learned implants, and then I started understanding, there is soft tissue around the implants as well. You need to look into that. Then I went and did some soft tissue courses. That's how I'm still in learning process of implants. So I'm doing one of the certificate courses with Dr. Misag Habibi here. Still on that journey.
Yes.
And, again, with All on Fours as well, I went and some of our friends got together. We went and did one of the courses, practical hands-on courses in India, because there are not many in Australia here now, on live patients. So with one of the best surgeons in India, we approached them. We customized course for ourselves, and we went and did the course there. Yeah.
Right.
That helped a lot too.
So you're saying your implant journey kind of started because one, you felt like dentures that wasn't your favorite, but also you didn't see the how could you get patients keep coming back to do adjustments? That wasn't fair on the patients. That was one. Number two was that you wanted something that was more retentive and improve on that. So you were doing those individual denture retained implants first. And then you were doing, I guess, single implants along that journey. And was that through what you were saying, weekend kind of courses? Was that through a little bit more structured? And then how did you make that decision to go into something structured like what you're doing now?
The first implant course which I did was Dr. Bob Hodkinski and Dr. Manas Sayed, the local specialists here in Perth.
Right.
It was through Southern Implants. It was like a 7-weekend straight away stretched course over a period of like 2-3 months. We did that first. It covered a lot of theory component, a lot of practical component, and we could do a couple of cases under supervision from Dr. Manas Sayed, the local periodontist here. She was a great help. So that is the first course, but I was still not confident enough to take on implants that time. We invested in implants. As I said, my colleague was doing more implants than me. I was not even still confident on implants because I thought I was never a really good student. My learning, I take 2-3 times. I have to see and do, and then I will get it. So first I did that. Then I went and did the MIS course in Melbourne as well. And then I was doing a little bit of like simple implants and everything, but I wanted to, I was never enjoying a single implant. I was like, why to take all this stress, like just give a bridge, I was thinking like that. But like the dentures pushed me to learn more implants. Actually, I could see the happiness in the patients, all their life they were wearing these loose dentures, never happy. and all of a sudden you put 2-3 implants and give the dentures, and I could see the happiness in them, and that gave me a lot of ability,
Motivation.
as well as like I'm really doing some difference here.
Yeah,
Even like
yeah.
single implant patients, they never, it looks good, okay, and they never that happy.
Yes,
No,
it's
but
not a drastic change. They don't realize how much of an improvement you've actually brought to their lives.
that's right, yeah.
Yeah. So tell me about how you came about your wisdom teeth extraction journey. Did you go through CPD for that?
I actually, as soon as I graduated, I went and worked in this surgery back in India. That time, as a new graduate, they don't give you any cases. All we do is assist, learn,
Yes.
and they don't even pay you. So it's like so many dentists in India. It's like, it's very hard to find a job. So one of my dad's friend son was a dentist, like he was really doing good. So I just went and approached him. I was like, I will come and work for you, or just assist you, or just do something here. And he used to get a lot of wisdom teeth, and he used to call one surgeon to come and do the cases for him. And I was assisting him, and I was like, really, wow, this is really good, the surgery. And as a new graduate, always you wanted to do some really huge kind of thing, where when you come out of the uni. That was really good. Actually, I was assisting him on really difficult wisdom teeth, and I really liked that kind of procedure. And when I came to this country town, nobody was doing wisdom teeth here. All referrals, even the simple ones, simple mesoamular, those kind of things, they were not doing. If it is buried, refer. Even if with the soft tissue, refer. Then I thought, like, okay, there is huge potential here. If I learn this, we can provide the service here. I went and did this from UWA. There was a good course, them oral practical surgery. They taught us how to section the teeth, how to open the flap, how to suturing and everything. And then slowly I built on that. I was doing simple cases and everything here. And I've still thought, like, we can provide more, because I was still sending out a lot of simple cases also, because people didn't want to do it in the chair. They wanted to do it in the anesthesia.
Yeah.
And that time I was looking for wisdom teeth courses in Australia, and only in Melbourne there is a course, and it used to sell out really fast. They put the date, and by the time you open, it's sold out.
Yeah.
And I think one of the good friends again suggested Khaled's course that time, DCI. It was in Cambodia, and under Dr. Anthony Go's supervision. It was fantastic course. I immediately booked on that one. I went and did. He taught us really from basics. How do you approach a case? How do you plan? How do you section everything? It was really gave me a good exposure. And then after that, I've read on a few books, really good books, surgical extraction books. And then I watched a lot of YouTube videos for at least like 3-4 days. Like, I only watched all these surgical extraction cases on YouTube. And first few cases I booked under general anesthesia were like simpler ones, young patients, which usually comes out quite easy. And then I build on that, like as I was getting more confident and I was getting more, comfortable with the procedure, I started going on to bit difficult cases and everything.
Yeah. Wow. Yeah. That's an interesting. Thank you for diving so deep into it. Yeah. So, of all those kind of CPDs, what's been your biggest clinical impact on your dentistry today?
First and foremost is a rubber dam. Now I can't imagine doing dentistry without rubber dam. Yeah, it was really changed. Not only my experience, my patient's experience as well, and my dental nurses. If I don't put rubber dam, they hate me now. It's like they come with a rubber dam, put it on, and yeah, it's because it makes their life easy as well. Like, if I do some of the difficult deep caries cases as well under rubber dam now, so comfortable and easy access, that changed a lot. That changed my dentistry a lot, and I'm enjoying dentistry more after the rubber dam course. And definitely Pascal Manes course. because the concept wise and thinking wise, it opened my mind. And then Dr. Tony Rotundo's mini residency, that gave humongous inputs into the theory knowledge and the way you treatment plan. Oh man, his work is awesome. Like, he's like, you can't even know which tooth he did, like, right? That kind of work and that kind of, you exposed to that kind of excellence in dentistry, it inspires you every day. Like, one day you need to reach that level kind of stuff. And Lincoln Harris hands-on full mouth as well, that gave a lot of input, not only understanding the dentistry but the communication part. So that's when actually after that I went and did my communication course. I was never really good with my English. So I sometimes I don't even know my patients are understanding me or not. I'll ask them to repeat, like, tell me what I told you.
Are you sure you understand?
That helped me as well. These and Jason Smithson's composite course as well, with Dr. Anthony Mack and Jason Smithson.
Yes.
That one. Actually, that was the first course where Dr. Anthony Mack was talking about digital dentistry. I wasn't a practice owner at that time, but like that gave me a spark. Like, if I ever own a surgery, I wanted to do digital dentistry. He was showing the case where he did indirect restorations. And he took the scan. He sent the scan to New Zealand, where his technician was.
Yes.
And the crown was there next day from New Zealand, and he was telling how easy it made into that, like, the workflow.
Yeah.
That inspired me a lot. So
you could see the future at that time. You could see how things didn't have to take days and days. It could just take a few days. It would get there.
That's right, and that was a really difficult case he was showing as well, and to the excellent work they put it into that. Like, the workflow was so seamlessly incorporated, which was like mind blowing that time for me. Like,
you could show that dentistry could be more. It could be boundless. You can.
That's right. Yeah.
Yeah. So was there any particular CPD that you felt that wasn't quite as beneficial for you at the time, and you would do differently next time?
I went and did this Redeslow course on soft tissues, and Ricardo Kern's course on soft tissues. My surgical skills that time was only limited to wisdom teeth and simple flap openings. Their surgery was like, world class.
Next level.
So man, it's like only thing all my CPDs, whenever I did, like, I used to line up my cases, even with full mouths or even with surgical extractions and everything. I used to line up 10 cases. Then I used to go and do this course, come back, implement immediately. Otherwise I'll forget. Like, if you don't implement, and immediately after the course, the mentors were in touch with you. You can share the cases. If you after like 6 months you post the case, they don't respond. So immediately that's only 2 courses I couldn't implement immediately, because like I didn't have that many cases lined up with the soft tissue surgeries. And being in a country town, people don't care about, like, their gums are not looking correct. And so that's I've learned a lot, but like I couldn't implement immediately. So now I wanted to do those courses again, because now I'm doing more restorative work, I'm doing more cosmetic work, I'm doing more like veneers and stuff. So that one area I wanted to redo and get into it very fast.
Yeah, I think that's an interesting point. For a lot of our earlier, younger clinicians who's we've had on as a guest, they talk about how they get more out of it the second time they go back. And for yourself, you're upfront about saying, hey, look, the first time I did it, I didn't quite implement it as much because I only had one or few cases that I could set up for it. But now that I have a bit more experience in it, and now that I have these cases lined up, I'm happy to go back and do it again, even though it will cost you a little bit of money, but it will benefit you, and you'll get so much more out of it. That's an interesting,
Yes, any course I did, like even full mouth course, I was spending around like 25 grand, 30 grand that time. I had to take like, a loan from the bank as well for one of the courses. But like,
Wow.
as soon as you come back, if you implement, that money will come back in like within 2, 3 cases. So that's the thing. If you don't implement, I think my personal experience is you just forget what you learned. As soon as you implement, actually, not only you remember what you learned from the course, you get more doubts. And those mentors, because we just did the course, obviously they are ready to help, and they give more inputs, and that drives you to the another course. Okay, I'm lacking my knowledge here, I'm lacking my skills here, and then you wanted to go. It just inspires you to do more, like every time. It
I
will.
do want to ask, yeah, like how, because a lot of new grads are probably, or recent graduates are thinking, hey, I've got, these veneer cases kind of, veneer course that I want to learn, how do I line up these patients so that I can do it soon after it? Because sometimes they're like, or, it might be 6 months down the track when I have these courses, but how do I push this patient to be waiting for me that far away?
Yeah, that's a good point. Actually, you asked, like a really good rapport with your patient helps a lot. If I see a case, I tell my patient, like a first Alan 4 case, I did. I told the patient, like, you're with this denture from so long. You're never happy with this. It keeps on cracking. It keeps on breaking. And I did a denture for him. It wasn't good enough. My principal did a denture for him again. It wasn't good enough. So I spoke to that guy, like, okay, I'm going and learning this particular kind of course, which is quite extensive surgery and everything. If you are happy to wait, I will do at a discounted price for you, because you will be my first case. And I kept him on wait list like that. Even with the full mouth case, I flew my own patient, and he only has to pay lab charge. I paid his flight charges, I paid his accommodation charges and everything. But the way he goes out and talk about you, like, to learn something, you spend your own money on him, but the value he gets out of it is humongous. After that course also, like the first case I did for a huge discounted price on a full mouth rehab case. The patient was not ready to spend that much money.
Yeah.
I was upfront, like I told, like, this, I've just learned this technique, I know what I'm doing, but I'm not at that level of, a master yet, providing this kind of work. He understood, and he said, like, okay, do what you want, and I'm happy to wait. I kept those couple of cases like that. And the second case also, I did like a little bit of composite work at the posteriors, but all anteriors was like ceramic, upper and lower. And I gave a little bit of discount again for the second case as well. I was upfront with my lab charge. I was like, with country town, you can't, like, something goes wrong, they go out and talk a lot, and it affects the reputation. Being in a small country town. So I was upfront, this is how much my lab charge, this is how much my time I am taking, these all are materials I need to use, this is how much it costs for me, this is how much you need to pay. If you're happy with it, I'm gonna do this at this price. But I am learning as well. Things may go wrong. Please bear with me. I'm happy to correct if something goes wrong. And they understand, and they will let you work on them. Because like when you learn a course, that all on 4 course, I've learned, I've did couple of cases there on live patients, but like under supervision. Here I come back, I don't have anybody to fall back, something goes wrong. So you need to be upfront with the patients so that they understand that you're trying to do something which you just learned.
Yeah. I think that's an important message, because a lot of, like I said, graduates want to take it to that next level. And to your point, you just got to be honest with them, both sympathetic and empathetic. Be open. You don't have to try to hide it, and hopefully, they come on understanding, and if they don't, then that's fine. You're happy to refer them on, but if they are happy to, then you're happy to go ahead with the journey.
And I understood in my journey here in 10 years dealing with these country patients, they're very appreciative if you tell them upfront. If you tell them like I've just learned this technique and I'm trying to implement, and I'm trying to learn from you, they're more than happy to be your guinea pig. It's like all my patients like that, whichever I did first, like became very good friends now. Which I learned, like I used to take each step procedure and everything, and I tell them like something may go wrong, I have to call my friend now what to do now here. I was upfront like that too. And they understand that you are trying to really give a value to them, but at the same time you are like you've been very honest with them.
I think that's a good message to kind of give to our community. So tell us, have there been any, you're talking about these struggles, have there been any other struggles along your CPD or dental journey so far that some of our viewers might not know about?
Yeah, the only struggle was like I was spending a lot of money on the CPD at that time, so I couldn't because being in a country town, I had to block my days, then go fly, find accommodation. There were not many courses in Perth that time, like even now actually, where you want to learn these awesome, advanced surgeries. Now people are coming up with good courses. Actually, I've learned a full mouth rehab course before I went to India to customize for ourselves. But there is a local prosthodontist, Michael. He ran a course and very supportive as well. But like we never allowed to do a live case ourselves. We observed him, what he was doing and everything. But still, as long as you don't feel, you don't get it. He makes it so simple. They are specialists and they've been doing for so long. He was doing implants, full mouth rehab, like he took only like 1 hour. You place 6 implants in 1 hour, like he was doing sinus lift, everything. You think it is simple, but as long as you start doing it, you don't understand like how much struggles you have to go through as a first case. That kind of thing is still not there in Australia, because a lot of other problems here comes into action as well, insurance and stuff. And if you stop off something, it goes on to the specialists. But these courses in overseas really help a lot. I wanted to do more in Australia. I actually, because of this COVID, I had to stop. I was about to enroll in AIA, Australian Institute of Academy with Implants.
Yes.
COVID, now Western Australia borders completely closed. I can't fly.
Yes.
But that kind of thing actually is still lacking in Western Australia, because we are not getting really good courses here in Perth. So we had to still travel. That's the main struggle, blocking your days and going for like 4 or 5 days. You lose money here as a practitioner, and then you spend already a lot of money on the course. That gives a little bit financial struggle. Other than that, all good.
I think that I think you've talked about so many different points there, and I think they're all very valuable. One thing I want to ask about is, you've worked in a party shop while you were doing your ADC exams. Can you tell us about that?
Yeah, as I told you, I came here as a new graduate. I was doing my English test. I had to do my theory, then I had to do my clinical exam. That time, the process was really long. It used to take at least 2 to 3 years. And being very poor in my English, I failed my English tests few times. Before I passed. Luckily, I passed my clinical and theory exam in one go. But like English was the kind, it put me off every time. I used to fail in writing. That's why all my referral letters also I put onto somebody else. Like, But yeah, that time, yeah, I worked in a like a potty shop. I really enjoyed it. There actually all our whatever my communication actually now in English, I learned from there. I picked it up from there. Um, it was again creative job. I joined as a store boy, and I used to play with these balloons, blow one balloon inside the balloon and color the balloons inside. I put the sparkles. I used to put small tiny glue inside the balloon, this clear balloon, and I used to throw some sparkles and blow it. All these different color sparkles go and attach onto those clear balloon. It used to really look good. I used to play a lot. Like it's like party every day in the party shop.
It was a party in the party shop.
Yeah,
I mean, look, hey, I wanna just dive into that a little bit more. So, you passed, two of the exams, but your English one, you're struggling with, and you failed it, and you have to do it again. Can you talk to me about, getting through the ADC exams is not easy, right? And so when you fail one component of it, that holds you back for another year.
That's right.
So talk to me about that mindset. I mean, because some of our listeners are going through that process of applying for ADC as well.
Yeah, thing is with ADC, they test your knowledge as a new graduate, like what Australian new graduate would be at what standard. As a overseas, you need to be at that standard. And though we have really good theoretical education back in India, we never had that much practical oriented education, because the kind of cases we get in India is completely different to the kind of cases we get in Australia.
Sure.
And the kind of financial situations Australian population is completely different to the Indian population is at.
Sure.
So when we came to Australia, like one thing, you need to be really good at communication, because in India, whatever we say is patient agrees.
It's golden.
Whatever we think best. You need implant. That's it. Patient, okay, do implant. It's not like that in Australia. You need to give a lot of information. You need to take informed consent. You need to give treatment options, not just one treatment option. You need to, tell everything, because it huge on, your indemnity insurance and everything. In India, it's there. It's not really well structured at that time when I graduated in 2005. Now it's caught up, but that was a really a big thing which we didn't understand that time, like in treatment planning and everything. So I went and did a little bit of training in Melbourne, which helped a lot. 1 month training, that time they used to call OTC. Melbourne Uni used to run for overseas dentists. That helped a lot. And but like I was still failing in English, which because I've never studied in English medium back in India, other than the dentistry. All my schooling and uni was in my own mother tongue language. So that as I said, my wife is also a dentist. She cleared the English in one go, and she was on to the exam. So I thought, like, okay, let her become a dentist, and I will enjoy with party shop. I thought, like, but like luckily I've cleared OTC after a couple of attempts, English test. Somehow I got lucky with writing the last time, but yeah, as soon as I've cleared my English test, I immediately I could clear my theory and practical exam.
I think that's an interesting story, because a lot of people, when they fail it, it just bogs them down. But for you, that didn't really stop you. I mean, even though your wife got through, and you're like, I'm actually content, I'm happy. I just know I just got to do it again, and then I can move on. But that's interesting, because I'm sure you would have seen people around you.
I know I was not good in English, so I thought, like, I had to get better. If I was good in English and I was failing, maybe it might be different. So.
Yeah, Fair enough. Yeah, because like I was gonna say, like a lot of people around you probably who are going through these exams with you, they're like, oh, like I failed. Like, how do I get? It's another year here. There's so many things weighing on me. I gotta, how do I do this again for another year? But I think, I guess what you're trying to say is like attitude is really important. How you look at, perceive things. Yeah.
I was happy. I failed the English test, but I was happy in the party shop. I was enjoying every day. So I was like, okay, when I pass, I will pass. Let's try again. That's all. But my wife pushed me a lot as well, because she knows me. She's my batchmate. She knows me from college days as well. Like, you do have the skill. Just pass the English, you will pass the test. Just pass the English, you will pass, dental exam. Don't worry, you keep on trying.
And did you look to, apart from just the 1 month of that course over in Melbourne, did you look to other places like Facebook or online resources to kind of prepare you for the ADC exams?
Really. That time there were not many like online options like was there back in 2006. Not many. Only we had a close group of friends who were going through the exams. We used to help in between ourselves, and but not many courses there that time, and not many Facebook profiles or anything.
Fair enough. Well, Dr. Vivek, there's so many more questions I actually want to ask you, but that's all the time we have for today. Okay. So thank you for coming on the show.
Thank you so much for the opportunity.
If you could let the people know how they can find you or what you've got going on in your life.
Sorry, I didn't understand. Sorry.
Can you let the people know how they can find you or what you've got going on in your life?
Well, yeah, they can find me on Facebook, like Vivek Reddy. You can easily find me on that. Right now I'm really enjoying my dentistry. I still want to do a lot more now. We recently got into 3D printing. I want to learn that part of dentistry now. I'm enjoying my dentistry at this point.
Awesome. So for our viewers, if you like this episode, drop a comment below on your favorite part, but don't forget to like and subscribe, and we'll see you in the next episode of CPD Junkie podcast. Thank you.
Thank you so much. Thank you, man.